This presentation analyzes the treatment of herbal medicine and closely focuses on its application in the Chinese culture, as well as its use for mental health. Herbal medicine is a traditional practice or a complementary and alternative medicine that is plant-based, so it uses whole plants or combinations and mixtures of plant parts and extracts. They're used to improve well-being, maintain health, or prevent and treat various different types of conditions. And it takes a holistic approach which focuses on the human as a whole and the connection between the mind, body, and spirit. So rather than just targeting the symptoms and the illness, they target the underlying cause and stimulate the body's own healing process. Herbs have been used for centuries in China and are a major part of an ancient system of healthcare called traditional Chinese medicine, which is based on natural remedies and discovered by the Emperor Shen Nong, who's also known as the father of Chinese medicine. And each herb in traditional Chinese medicine has a different healing property. It heals a specific organ system and restores harmony within a particular part of the body. And over the past several decades, Chinese herbs have become increasingly recognized and prevalent throughout the world in both developing and industrialized countries. So when examining the use of herbal medicine in the Chinese culture, it's necessary to consider core concepts concerning their ethnic beliefs of health and illness. So in traditional Chinese culture, each living entity is sustained by the balance between two opposing energy forces called yin and yang, which together make up qi, which is the vital energy or life force. It circulates throughout the entire body through pathways called meridians. On the photo here, you see that there's 12 main meridian channels, and they all run throughout the entire body in a specific direction and connect the whole body. Qi is the spiritual or cosmic energy that underlines all being, so it dictates the body's functioning and the processes, and it serves to protect and maintain harmony. So it regulates a person's physical, mental, emotional, and spiritual balance and maintains health. When changes in nature create imbalance between yin and yang, this obstructs the flow of qi, and this disharmony within the body manifests as an illness or physical symptoms of an illness. So herbal medicines aim to correct this energy imbalance and restore the harmony within the body by releasing the blockages, removing harmful elements that might interfere with the body's operations, and improving this flow of qi. There are many different preparations of herbal medicines, water decoction being the most common, which involves adding one or multiple herbs to boiling water for a certain amount of time and separating the herbs from the liquid and drinking it. They also may come in powdered form, and these powdered herbs can also come as honey pills when they're fused with concentrations in honey. Another method is that herbal extracts and powders can go through coating or encapsulation methods and be delivered as over-the-counter pills. There are many sources available throughout Chinese communities that may influence a member's decision to use and select herbal remedies. One being a traditional practice for families to maintain a household supply of herbs that can be easily accessed to provide healing. Professionals also are a significant source, as their ability to contribute expert opinions and advice can easily influence a decision, and they have comprehensive biomedical backgrounds. Another would be traditional herb stores that are components of these communities, and they serve as sources that may provide quasi-professional recommendations based around traditions and family practices. Lastly, herbal medicines are available from herb stores, grocery stores, and can be accessed by other members of the community, making self-medication a significant source, as these surroundings can impact customer decisions by presenting available herbs, labels, experiences, and recommendations for the use of this type of medicine.
I will be discussing most common ways Chinese herbal medicine are used and its beneficial and therapeutic effects in treating mental disorders. They say approximately 40% of people who suffer from insomnia have a comorbid psychiatric disorder, most commonly depression and anxiety. Traditional Chinese methods believed it was when liver qi was not flowing freely in the body was when it manifested different emotions such as depression, anxiety, and anger. They focus on the concept of yin and yang, which mirrors the biomedical concept of parasympathetic and sympathetic system. Yin is the portion of the qi that is cold, heavy, passive, dark, while yang is the opposite, active, aggressive, hot. Qi is defined as the vital fluids and energy that flows through our bodies. Imbalances of qi was believed to cause rise in illnesses. Free and Easy Wanderer and An Shui Wen were Chinese herbal medicines used to treat anxiety and insomnia. Free and Easy Wanderer is commonly used to treat anxiety and depression. It softens the liver, regulates the qi, nourishes blood, and strengthens the spleen. On the other hand, An Shui Wen specifically treats insomnia and anxiety. It calms the shen, nourishes the heart, tonifies blood, and nourishes yin and strengthens the qi. It is proven to improve sleeping patterns and allow patients to no longer feel lethargic. Women who experience early menopause were 2 to 3 times more likely to suffer from depression. Recent studies indicated that women's experience of depression and anxiety was higher in menopausal transitions than other periods. Bushen Shugan granule was composed of Rehmannia root, Radix cucumae, and Pusatum raruptorum. BSSGP is the combination of traditional Chinese medicine and traditional psychotherapy, and has commonly been used to treat psychological symptoms such as menopausal syndrome, but has also proven to be effective in treating mood disorders in menopausal women. Instruments used in the study were self-rating depression scale, SDS, and self-rating anxiety scale, SAS. Its use showed reduction in the total score of SDS and SAS. After the 12th week of treatment, there was an improvement in both physical and psychological symptoms of menopausal women with mood disorder. Attention deficit hyperactivity disorder, also known as ADHD, is characterized by structural abnormalities in the brain, especially the cortex. It is also characterized by hyperactivity, impulsivity, and impairments in learning and memory. Rehmannia radix preparata, extracted from wine, steaming the Rehmannian root, has antioxidant, anti-inflammatory, and neuroprotective properties. It has been used for many years with effects of nourishing kidney yin, based on traditional Chinese medicine theory. Recent studies have shown Rehmannia radix preparata inhibits spontaneous activity in mice, improves learning and memory in rats, and exhibits antidepressant effects. It was hypothesized to be effective in treating ADHD by alleviating neurodevelopment abnormalities, neuronal apoptosis, and energy metabolism failure.
Advantages to herbal medicine are availability, affordability, and the beneficial healing properties. So for availability, herbal medicines, they're naturally occurring because they're made from plant-derived substances and are not mixed with other chemicals or synthetics. Different cultures use different herbs to create these medicines based upon their environment, geographical location, and social conditions. So no two cultures use the same herbal medicines. Chinese cultures focus more on individuals' holistic health rather than a specific disease, and they do not have to go and get a prescription for a doctor to get these herbal medicines, which is more convenient. It's also more affordable than other conventional pharmaceuticals. This is appealing to low income and middle income countries, and it's more available because there are more herbs and you don't have to make the synthetic chemicals. It has beneficial healing properties, so it's used to treat both acute and chronic conditions. And because it's naturally made, it doesn't have the other harmful chemicals in these medicines that can cause other problems inside the body. Some disadvantages of herbal medicines is lack of education, lack of regulation, adverse effects, and use of conventional drugs with herbal medicines. A lot of people think that because these medications arise from herbs that they are naturally safe to take. This is untrue if these herbal medicines are taken incorrectly. Herbal medicines still require education about how to properly take them and appropriate times to take them. If not taken correctly, it could lead to unintentional injuries, overdose, or negative interactions with prescription medications or food. For lack of regulation, many countries do not regulate their herbs used in the medicines. This leads to safety and quality problems related to incorrect plant use, contamination, and adulteration. Many adverse effects can occur when using the herbal medicines incorrectly or inappropriately. Some examples of adverse effects that occur from the use of Chinese herbs include the herb ma huang, which is known as Epichandra seneca, and that's used for breathing problems but has caused heart attacks and strokes. The other herb, ginkgo, which is used in ginkgo biloba, this is used to stimulate the peripheral circulation but can result in excessive bleeding, especially during surgery. Both of these herbal medicines are used to treat specific things, but if used incorrectly, they could have horrible adverse effects that could become fatal. Another disadvantage is the use of conventional drugs with herbal medicines. When people are using these herbal medicines, they do not seem that it is important to tell their healthcare provider because it's not a prescription drug. All medicines, such as conventional, prescribed, or herbal, need to be reported to a healthcare provider because interactions can occur between these medicines when taken together.
Miss Chen is one of our patients. She's a 55-year-old female of Chinese descent. She's married with 5 children and has a history of depression. She recently came into the hospital this morning as a result of suicidal ideation she's had over the past week. Although she speaks little English, with the use of a translator, we have discussed that her depressive symptoms are likely a result of her financial stress. She has admitted to not adhering to her current medication of Zoloft of 25 milligrams daily. Some of her main symptoms are insomnia, fatigue, decreased appetite, and poor concentration. When educating Miss Chen about the possibility of using herbal medications and traditional Chinese medicine, we would be sure to use a translator because she does not speak English as her native language. We would have a Chinese translator to be able to effectively communicate um, about the possibilities of alternative treatments for her. We would also have her family members alongside. Her family members would help to understand what's going on and to provide insight to types of treatments that would be effective for her because of Miss Chen's vulnerable state that she's in with depression and suicidal ideation. It's important to have family members alongside to help advocate. Additionally, because of her mental state that she is in, we would be sure to use therapeutic communication and show empathy and patience when communicating with her. One tool that we would use would be brochures. This would allow us to have the information about the herbal medications in a written format so that she can look back at the information at a later time and also share the information with people who might not have been there as we were educating her in person. We would be sure to refer her to herbal medicine providers that we trust. It's easy to be deceived in the realm of herbal medicine, so we would be sure to provide her with references that we know patients have had success with in the past. And we would also discuss the importance of medical adherence, because we know that she has not been adhering to her current medication of Zoloft of 25 milligrams because of cost. We would discuss that importance, and we would also highlight the benefits of a decreased cost with herbal medication.
In order to provide the best possible care to any patient, including patients like Mrs. Chen, it's important that our providers are culturally competent. And in order to ensure that a certain level of cultural competency is being met, I think that it's important to set goals so that these mental health care providers and institutions as a whole can increase their cultural competence regarding herbal medicine. If there's not a goal, you really don't know what you're working toward. So, for example, a possible goal may be to increase links to networks of people and providers from different cultural backgrounds and specialties. And now this goal could be set by individual providers in a practice as well as an entire practice, hospital, or institution. So if a provider or all of the providers in a hospital or practice or institution were to increase their networking with individuals in the healthcare field who do specialize in remedies such as herbal medicine, then it would allow for them to make referrals later on and just ultimately provide a better healthcare platform for a patient interested in this type of treatment. So now that we have set a goal, which is to increase the networking between physicians in a certain institution and relevant healthcare providers or individuals who specialize in herbal medicine, it's important to set steps for interventions, much like we do with the nursing process in the clinical setting. One intervention may be that institutions should hold seminars or presentations which emphasize the importance and effectiveness of herbal medicine. These seminars may be held every week, every month. An example of something similar to this would be the grand rounds, which are held at Johns Hopkins. Just in my past clinical experience at Johns Hopkins on the pediatric psychiatric unit, each Monday when we went down for lunch, we would go to something much like a lecture hall and hear from different physicians on the research, new discoveries, changes in demographics, etc. of substance abuse. So instead of substance abuse, a hospital or institution can do these grand rounds focused on the topic of herbal medicine to educate all providers and staff of this hospital. Another intervention could be that each provider should identify, research, and visit at least 2 practices, apothecaries, or individuals that practice herbal medicine. And this is key in increasing that referral volume. This will then allow physicians at this institution to have sort of a directory to refer patients to when they believe that their scope of practice may not be the most beneficial for a certain patient. Now that we have set a goal and implemented interventions, it's time to evaluate whether or not this goal was met, whether or not these interventions were successful. And the way that we can do this in this type of scenario is through direct observation. Specifically, we will be able to see in practice whether or not more connections have been made and whether or not providers have become more culturally competent. Specifically, we should see things such as patients being educated more often through direct conversation with providers as well as through the use of brochures from the institution. And these brochures would be a direct result of the knowledge that physicians and healthcare providers at this institution have gained through networking as well as through the seminars and presentations, such as the grand rounds. In addition, the directory of potential references and referrals certainly would grow larger, and that would be quantifiable. And lastly, providers would refer more patients to practices and institutions that they trust that do specialize in herbal medicine in the event that the treatment that a patient seeks after is outside of the scope of practice of a physician at a particular institution.
So these are the references that we utilize for our research in Chinese herbal medicine. We hope you enjoyed this presentation.